Emergency or urgent care? What's best for you?
At one time or another, all of us have to decide whether to go ourselves or take a family member to get treatment for an injury or sudden illness. The question is, where do you go if your doctor's office is closed? Do you go to urgent care or the nearest emergency room? Making the right choice could be a lifesaver. Always call 911 or go to the emergency room if you have a life-threatening situation or serious injury, including if it's hard to breathe, you have chest pain, you have broken bones, for head injuries, you lose consciousness, you have a serious wound, especially if there's heavy bleeding you can't stop, you have a severe allergic reaction, sudden vision problems, a fever more than 104 degrees Fahrenheit, or if you cough up blood or think you've ingested poison. These are all true emergencies, and you should seek medical help immediately. You should also go to the emergency department if you have serious burns, repeated vomiting, vaginal bleeding during pregnancy, or seizures if you haven't been previously diagnosed with epilepsy. What if your condition isn't life-threatening, or you don't have a serious injury or illness? There are several urgent care and community health centers that can help. Most have extended hours and accept Medi-Cal. Health centers or urgent care is right for you if you have allergic reactions, animal bites, cold or flu symptoms, ear infections, food poisoning, minor fever or rash, mild asthma, minor burns, simple fractures or sprains, sinus infections, strep, or sore throats. Plus, your wait at urgent care is often shorter than at the emergency room. Of course, you can always call your doctor's office and ask which option they recommend. They can handle questions after hours. Getting the right medical care at the right place and right time can not only save time and money, but also save a life. For more information, visit palomarhealth.org.